What is going on, guys? Ozempic face, Ozempic butt, and now Ozempic teeth? Let's have a look at the latest concerning side effect that might have a possible link to GLP-1 use. Hey friends, welcome back to the channel. I'm Stephanie, and today we're diving into a surprising side of the wildly popular GLP-1 medications like Ozempic, Wegovy, Zepbound, and Mounjaro. Sure, they're amazing for weight loss and for blood sugar control, but what about their effect on your mouth? Yeah, people are talking now about Ozempic teeth, and we're going to break it down. The first thing I want to say is I feel bad for Ozempic. I think they get a bad rap. The word Ozempic rolls off the tongue so easily that they're getting the blame for everything that's happening to our bodies when we're on these medications. So you get the Ozempic butt, you get the Ozempic face, and now the Ozempic teeth. But in reality, any of these side effects can be tied to any GLP-1 medication. GLP-1 receptor agonists help manage diabetes and promote weight loss by slowing digestion, curbing appetite, and improving blood sugar levels. Drugs like Ozempic, Wegovy, Zepbound, and Mounjaro are making headlines, and not just for their result. Alongside the usual side effects like nausea and GI issues, new buzz is growing online and in dental offices about potential oral health problems. So what exactly is Ozempic teeth? Sounds terrifying. Sounds like those dreams that we all have had where your teeth are falling out. Well, it's a term that's been coined on social media to describe dental problems some users say they've developed after starting these medications. Things like tooth decay, gum irritation, and even bleeding gums. Now, it's important to note there's no official scientific evidence yet linking these drugs directly to dental damage. But dentists and patients are noticing a trend, and some of the common side effects might explain why. According to Dr. Ricky Marshall, a dentist in Arizona, patients in both of his practices have reported dry mouth when using Ozempic. This might be the key link. Saliva plays a crucial role in neutralizing acids, preventing decay, and keeping your gums healthy. Less saliva means more plaque, more cavities, and more sensitivity. As Dr. Whitney White from Aspen Dental says, dry mouth leads to plaque buildup, and that leads to dental problems. GLP-1s slow digestion, which can increase stomach acid and lead to nausea, acid reflux, and even vomiting. Dr. Marshall says this extra acid absolutely contributes to tooth decay. It wears down enamel, it causes sensitivity, and it makes your teeth more vulnerable to cavities. So how can you protect your teeth if you're on one of these medications? First, hydration. Hydration is key. Drink lots of water. You should be doing that anyhow. But if you haven't before, do it now. Chew sugar-free gum to promote saliva in your mouth. Take your meds in the morning, not at night. Nighttime dry mouth is worse for your teeth. Use antacids, and I am an antacid user. Use antacids cautiously. They may help with the reflux, but long-term use is not ideal. And of course, you absolutely need to see your dentist regularly and be open about what medications you're on. Right now, companies like Novo Nordisk and Eli Lilly don't list dental issues in their prescribing information. But with growing anecdotal evidence and patient stories, it's something worth keeping an eye on. If you're taking a GLP-1 and you notice any changes in your mouth, don't ignore them. Bring it up with your dentist and your doctor because your oral health is part of your overall health. Thanks so much for tuning in today. If you have experienced any oral health changes while taking GLP-1s, please share your story with us in the comments. I really want to hear how many people are truly impacted by this. Let's keep this conversation going because it is important. Don't forget to like, subscribe, and hit the notification bell for more real talk about health, science, and everything in between. I'll see you next time. Keep smiling.